Frank White. Frank is the Senior Vice President of ORC Worldwide, responsible for ORC's occupational safety and health and environmental practices. Mr. White previously spent 5 years in private law practice representing clients in occupational safety and health litigation and rulemaking. Prior to that, Mr. White worked in the Department of Labor, including serving as Deputy Assistant Secretary of Labor for OSHA and Associate Solicitor for OSHA. Mr. White received his undergraduate degree from Duke University and his JD from the University of Connecticut Law School.
Good morning, and thank you, Congresswoman Woolsey and members of the subcommittee for the opportunity today to testify on behalf of ORC Worldwide and discuss how leading corporations work to make sure that serious risks to worker safety and health get addressed on a corporate-wide basis. I want to do my best today to offer Mr. Torres, his family, and his coworkers hope that there are, in fact, effective steps that companies can and do take to prevent the kind of tragic loss they've suffered. And I know that his appearance here will make a difference. ORC Worldwide is an international consulting firm whose Washington, D.C. office works with more than 140 leading global corporations to help them achieve health and safety excellence. For 36 years, our guiding premise has been that providing safe and healthful working conditions is the mutual concern of workers, employers, and government agencies, and it takes the cooperation and collaboration among those three to find solutions to safety and health issues. So how can a company make sure that a serious safety or health risk that is known to exist at one of its locations does not go unnoticed or ignored at another location? And what steps does the business need to take to assure that no worker is endangered by a similar risk at another facility? First and foremost, the indispensable foundation for effective action is the establishment of a clear and authoritative policy from the corporation's senior leadership, the CEO, stating explicitly that the corporation as a whole will insist on full compliance with all worker safety and health standards, and senior leadership should be actively engaged in monitoring to make sure that that's done. Second, in addition to the clearly articulated policy of full compliance, companies that consistently achieve superior safety and health performance and that actually sustain corporate-wide compliance rely on a safety and health management system that includes several key elements. And I recommend to the committee the ANSI Z10 guideline that was promulgated in 2005 as a basis for a good, solid safety and health management system. The fundamental goal of a comprehensive management system is the elimination of injuries and illnesses through a continuous process of identifying, assessing, and reducing risks. And there are a few key elements in those systems that are applicable here to corporate-wide abatement of hazards covered by OSHA requirements. First, you have to establish clear lines of responsibility, authority, and accountability through all levels of the corporation, from the CEO on down to line employees. All management levels and line employees must be assigned, understand, and be accountable for their roles in the management system for finding and fixing hazards. Second, you must encourage employee participation in reporting of unsafe conditions. No management system can function effectively without employee participation. Line employees are a company's most knowledgeable resources about hazardous conditions, and they must be encouraged to report such conditions with full confidence that management will act to correct those conditions. Third, there must be regular safety inspections and audits. Part of the responsibility of management at each company facility is to perform periodic reviews of each workplace to identify, evaluate, and control risk. Fourth, perform root cause investigations of significant incidents. Now, most large employees do incident investigations, however, of serious incidents or injuries, but it's also important to look at near misses and incidents that do not necessarily result in injuries, particularly those where serious injuries could have occurred. And the nature of those investigations needs to go beyond just looking at the unsafe act or behavior of the employee. You have to examine more closely the root causes of the incident. It's ORC's experience that, in general, there are usually more fundamental, systemic, cultural, and workplace design issues, reasons for such incidents that need to be addressed beyond the worker behavior. So you can't stop at looking at what the worker did. You have to go beyond that to looking at root causes. In addition to these sort of basic elements, many companies that have specifically addressed the issue of looking at an issue in one workplace and making sure other workplaces are looked at as well, are the following. A requirement that each workplace in a corporation report significant incidents to a centralized corporate function or team. Then the corporate team needs to look at those incidents and make some judgment as to whether there might be some potential likelihood for occurrence at other locations. Then there has to be an alert to those locations to take action, to look and evaluate whether there's a problem. And then again, responsibility and accountability to those other locations to investigate and, if necessary, to correct those actions. And then follow-up at the corporate level to make sure, in fact, those corrective actions have been taken. Just a moment on, if I may, on how OSHA can contribute. Obviously, the issuance of citations for serious violations of an OSHA standard must be issued when they find that a corporation has violated a standard, and particularly to take strong action, including egregious penalties, when there are multiple violations at multiple sites. That's essential. But more fundamentally, OSHA can really do more, and they've tried to establish some procedures in their enhanced enforcement program, as you know, and basically those procedures seem to be pretty sound. The question is, are they functioning correctly? And I hope we can explore during the course of this hearing how to make them more effective. So, and finally, I'd say that in addition to these kind of specific programs, ORC would strongly encourage OSHA to search for new ways to promote and advocate the value of safety and health management systems, because in the long term, nothing will have a more significant impact on the reduction of risk, injuries, and illnesses, as well as improved compliance, than the widespread adoption of such systems, and OSHA needs to take a role in doing that. Thank you, Madam Chairman.